Today we are going to see the drug class on sulfonylureas. So sulfonylureas is an important class of drug under oral hypoglycemic agents. So now let's see the drugs under sulfonylureas. So under sulfonylureas there are first generation drugs and second generation drugs. In first generation drugs there are tolbutamide, tolsamide and chloropropamide. So these drugs are not frequently used nowadays because these drugs are associated with thrombocytopenia, agranulocytosis, hemolytic anemia and hyponatremia. Only the second generation drugs are now currently used. So these drugs are glyburide, glipizide and glimepiride. So now let's see about the mechanism of action of these drugs. So what these sulfonylureas drugs do is they stimulate the insulin release from the beta pancreatic cells and also reduce the hepatic glucose production. So by this way they reduce the blood glucose levels. So now we know this is the pancreas. So now let's assume this is the beta pancreatic cells. So once we eat our meal, the glucose levels in our body, what happens? It increases. So when the glucose level increases, there is more glucose transported within these beta cells with the help of GLUT4 transporter. So once the glucose gets transported, it gets converted into ATP. So more ATP is produced within the cell with the help of mitochondria. So when ATP increases, this ATP goes and blocks this ATP sensitive potassium channels. So what this channel usually do is it will take the potassium within the cell and will pump it out of the cell. But once it gets blocked, the potassium within the cell will increase. So once the potassium increases within the cell, the calcium channel in the cell will also open. So when calcium channel opens, what happens? Calcium flows into the cell. So calcium levels increases. So when calcium level increases, finally the stored insulin within the cell will also get released, and thus the insulin get released from the beta pancreatic cell. So this is the totally the whole process by which insulin is normally released. So now let's see how this drug causes the release of insulin. So our drugs sulfonylureas, for example, we have taken glimepiride. So what this glimepiride does is it goes directly and blocks this ATP sensitive potassium channel. So when it blocks this ATP sensitive potassium channel, what happens? The potassium level within the cell increases. So depolarization of the cell occurs. So when the cell gets depolarized, more calcium flows into the cell, calcium level increases, and this ultimately causes the release of insulin through the process of exocytosis. So this drug indirectly increases the beta cells insulin release. So this is how our drugs act. So this is the mechanism. Now let's go into the adverse drug reactions. So there are two main adverse drug reactions. So they are hypoglycemia and weight gain. So hypoglycemia we usually say when the blood glucose level falls below 70 mg per dl. So when the blood glucose levels falls below this level, we say it as hypoglycemia. So usually the signs and symptoms in hypoglycemia are dizziness, drowsiness and increased hunger, shivering and shaking. So these are some of common signs and symptoms of hypoglycemia. So it is important for us to explain these signs and symptoms to the patients while they take this drug. So the next is weight gain. Weight gain usually occurs due to increased amount of insulin released when this drug is taken. So now moving on to the contraindications of this drug. So There are two main contraindications. This drug should not be taken during renal and hepatic dysfunction. So, patients who have these renal and hepatic dysfunctions must avoid this drug. So, it is also important to know that elderly people should also avoid this drug because they may also develop hypoglycemic events and they may have increased risk of falls. So that's it about this class of drugs, sulfonylureas.